So I would like to start out just by talking a little bit about some of the characteristics that we saw in the character of Jared tonight in the play. Specifically some things that might seem a little out of the ordinary, like his extreme interest in etymology, the toothbrush situation, the kind of sensitivity to smells, and I wonder if the doctors that are with us can tell us a little bit about how those correspond to some of the symptoms of autism and Asperger's.
Well, I'll start off and you can talk about the sensitive stuff. Okay. So definitely Jared was a great portrayal of autism spectrum disorder.
Thank you.
He definitely revealed quite a few characteristics of social communicative deficits that are common to autism spectrum, as well as some repetitive, restrictive patterns of behavior. So obviously it was very literal. Even his posture was very characteristic of how certain individuals on the spectrum walk. And obviously the overarching interest in etymology and the dictionary totally took over all of his social conversation. So he did definitely demonstrate a lack of perspective taking or seeing where others were coming from. So he could call people what he thought he could call them. It was very literal, but he couldn't take it when other people called him that. So obviously he quite didn't understand the impact of his behavior on others. So all that came across very nicely.
And what's the significance, before maybe you're going to get into this, the toothbrush thing?
That oftentimes when we have the autism spectrum is kind of a term that was used tonight. In the autism spectrum, there were really three conditions: autism, Asperger, which is what Jared, the main core diagnosis that we were thinking about with Jared in the play. And then the other condition is pervasive developmental disorder, not otherwise specified. And in Asperger's, typically a lot of the individuals have average intelligence, normal language, but that social piece and that restricted behavior pattern. And the toothbrush is an extension of that restricted pattern. Oftentimes individuals have for Jared, the dictionary was comfort, the toothbrush was comfort, and so much of the behavior, especially when he was anxious, when something was difficult, individuals often rely on that one tool, one instrument, especially if they don't receive intervention to learn some other coping mechanisms. And sometimes those have a sensory flavor or a sensory flair, and so the vibration of the toothbrush was calming. Sometimes that's learned behavior. It may have started early on. Toothbrush felt great, it was good, and so I'm going to kind of use it across situations.
Now, I had heard of hypersensitivity to noises and lights, but I had never heard of a hypersensitive sense of smell before. Is that something that you would see in your patients? Is that pretty typical?
Diagnostically, the diagnostic criteria has changed for the autism spectrum within the last year. And that sensitivity, unusual responses to sensory input, was previously considered kind of an associated condition. In the new diagnostic criteria, it's actually one of the characteristic behaviors in the diagnostic criteria. So it really reflects this better awareness that these sensory interests, sometimes it's hypersensitivity, and other times it's under-responsiveness or hyposensitivity, so they don't respond. Parents will come in and say, he's got this high pain tolerance, like he bounces off the wall, he steps on this sharp rock, and he has no pain tolerance. And so it's the opposite, there's an under-responsiveness. So we really see full spectrum.
All right, I'm going to go down to Adam now for a second. Don't be nervous. So the doctors kind of referred to what Jared's perception of people on the autism spectrum was. And although he had read this book, he definitely had some very rigid ideas of what that meant. And so I'm wondering from you, what has been your experience of the misconceptions that people might have about people on the spectrum?
In my experience, one of the people usually think of people on the autism spectrum as one of two things. Usually either the stereotype of like the guy who can't dress himself or can't talk or can't, and the other one is pretty much Sheldon from The Big Bang Theory.
So like hyper intelligent but
Yeah.
socially very awkward.
Yeah.
So how do you decide when to tell people that you're on the spectrum, and how do you tell them, and then how do they tend to respond after, because they already know you and what you're like?
I don't really make like a conscious decision to bring it up. It's not like, hey, I have something very important to tell you. If I bring it up at all, it's usually more in casual conversation. And you said with people responding, the last 2 times people have found out and I've been there to see it, it was like, whoa man, you have autism? I had no idea. That's actually what the guy sounds like.
Adam's a theater kid too, so he does voice impersonation.
That was actually in rehearsal for Joseph and the Amazing Technicolor Dreamcoat. So it happened during that.
So Richie, tell us a little bit about how you prepared for this role, because it seems like it would be a little intimidating.
Actually, going into it, it worked out really nicely because my brother has Asperger's, so I kind of just took a lot of cues from him. He definitely has hypersensitive smell. He doesn't have a toothbrush, but he has his bunny, and he's 22 years old, and he's still not everywhere, but he still has his bunny. Like, he will never give up his childhood bunny. I was trying to embody his posture, because I mean everything I did on stage was kind of an extension of what I observed growing up with my brother. They had a lot of trouble getting him to go to school, and they put him through a lot of therapy. But he's doing really well, and he's definitely matured a lot. So that was nice to be able to, I don't know, use my brother as an inspiration.
Is he going to be able to see the show?
Yes.
Yeah.
I don't know what night he's going to come. I kind of wish he would have come
Is that
tonight.
scary?
A little bit. I don't know if he'll say anything, actually, but he might.
Yeah, and
Yeah.
your folks will come, I guess? And,
Yes.
Yeah.
I'm sure they'll enjoy it.
Yeah.
But Jared's a really fun character, too, because he's not stereotypical, as you said, like Sheldon from The Big Bang. Like, he's not, like, doing math equations. He's actually really interested in language, which I think a lot of people wouldn't associate with someone on the autism spectrum. So that's very cool.
Well, that's kind of, isn't that one of the differences between Asperger's and autism, is the language ability?
Right. Asperger's is diagnosed when there is no history of delayed language and there is no intellectual impairment.
How old was your brother when he was diagnosed?
I honestly couldn't say he's ever, I don't know if he's been officially diagnosed. But he was probably in middle school, because there was a period, or it may have been elementary school, because there was a period of time my mother could not get him to go to school. He was terrified of going to school and interacting with people. So, yeah, he ended up going to Academy for Individual Excellence because they were more conscious of that and they could kind of work with him there. So he was pretty young, but he was always just, I was always the really outgoing one and he was the introverted one. But what's interesting about the character Jared as well, I just kind of want to throw this in here. Annie Baker, her brother was diagnosed with Asperger's. So at 17, and she's a psychologist and an Asperger's specialist.
Oh, wow.
Yeah.
Her mother.
Her mother. Annie Baker's mother, is what I mean.
The playwright.
The playwright, yes. And so she made him like star in this video about Asperger's, and so he kind of went through this whole turmoil where he kept being labeled Asperger's, like Jared, though I do believe Jared has Asperger's. And then he kind of grew out of that, and he wrote this whole piece on how he reflected on what it was like to be labeled as Asperger's.
Because eventually he wasn't.
Yeah,
eventually
yeah.
They were in his 20s, and he found his place socially, and
yeah, he was fine.
with all these geeks in New York, like all these, like they had his interests, and And they're like, oh, you don't actually have Asperger's, and his mom apologized. Like, I'm sorry that I boxed you into that. That's not actually, he was just awkward. He was just
Yeah.
and awkward and
Wow.
geeky, and
Yeah.
that's not what it was. Yeah.
Well, that makes me curious about your experience with patients that are diagnosed as teenagers and older adult or younger adults, as opposed to those who are diagnosed when they were little. Like Adam was diagnosed when he was 3. So it seems like it'd be a different experience.
And I think that where you see, even with the Center for Disease Control recent data, how the prevalence has gone in a really relatively short period of time, from 1 in 80 to 1 in 144 to 1 in 80 to 1 in 68, when they've done these kind of prevalence data surveillance across the country, the age groups that consistently grow are the age groups that are in the 10 and over age group. And so we're seeing individuals become identified, and parents report that their child has autism because of the diagnosis happening much later in the individual's life. And the theory really nationally is that it's because higher functioning individuals using that label with more language, with better developed language, who are socially awkward, are being given that diagnostic label. And I think that for some, with intervention, you can develop the coping mechanisms, you can develop those social skills so that diagnostically it's not as prevalent and not as disability creating.
Right. What kinds of interventions would you do if you had a patient like Jared?
That's Grace's
What would benefit
expertise. That's what I mean. I will tell you that when I got the first email, I was like, "This is Grace's day, every day of the week."
Oh yeah.
So
Well, I do see adults on the spectrum as well. So typically, if an older individual was referred to a psychologist, well, we would first of all start off with assessing their strengths and their challenges, and then we would use their strengths to target some of those challenges. So typically, most individuals on the spectrum process information visually and have a preference for processing information visually versus verbally. So we provide all sorts of visual supports to help clarify some very abstract social concepts. So we also provide visual supports in the form of role play and modeling to help these individuals identify the nuances and subtleties of social cues and identifying those cues. And then, of course, we get them to participate in these activities. And when they get to a degree where we can get them to generalize, that's when I try to refer them to resources in the community, specifically places like vocational rehabilitation, as well as the Center for Accessible Living. And these are great resources because what we like to do is, especially as individuals get older, the focus is no longer just targeting those specific deficits, but the focus changes to vocational fulfillment, relational fulfillment. So we want them to get nicely matched to jobs that are meaningful. And so we like them to have a job coach, and we like them to influence the potential employers. And so what I like to do is form a nice supportive network for the individual with the on the spectrum, so we can communicate consistently and target some of those difficulties that arise immediately and put out those fires before things fall apart.
Right.
So
we can teach those social skills and the understanding of those social nuances, and you can do that within the confines and comfort of that clinical setting. But the real test is to be able to generalize it out to the community. And so a lot of times we also spend time teaching them individually, teaching those discrete skills and understanding individually in one-on-one sessions, and then generalize them to group settings. And so we may have a group in which the goal for the day is greetings, And so we do role play, and that's a fundamental part of what that group session is.
How to greet appropriately.
Yeah, and an individual may take the lead for that group, and etymology may be the focus that week if they're taking the lead, so that the others have to steer conversation beyond what their special interest is.
So they have to learn how
So
to
they
talk
have
to people about
perspective
what the other people
taking,
want to
give
talk
away.
about. Yeah.
Right. And so you generalize them, and you can do that safely within a clinical setting before you have to go out to the pond
Yeah.
to try to generalize it.
So you get your training wheels
Yeah.
first.
Is it okay if I ask a question?
Sure, I have a couple more, but yeah, go ahead.
Well, what came up for me is we worked with students at DePaul some through Looking for Lilith, and in the past when I tutored some there too, and I remember learning about dysemia when we were there, and I'm curious about are they still using that diagnosis of dysemia being a kind of social dyslexia where you have trouble picking up social skills, social cues, because they started doing a life skills class where you would learn with tape. This is your personal space. This is a little out, and here are the people that are supposed to come into this space, here are the people that are, and the whole, they use that book, Helping the Child Who Doesn't Fit In. So I'm just wondering about the overlaps of dysemia, and they're looking at that with it being a social dyslexia, and autism and Asperger's. Because I know at DePaul it's like not students on the autism spectrum, it's specifically students with dyslexia and other learning differences, perhaps Asperger's, I'm not sure actually right now.
A huge overlap in how we provide intervention. We certainly use visuals like that. So we also, what is concrete, what is literal for the individual to understand? So 1 arm's length is personal space. So we give them little cues like that so they can use that to relate to, this is the distance I can get to somebody else. So we use a lot of those strategies in
But what would be between dysemia and Asperger's? Just what are the differences if you were diagnosing someone? Well, they have dysemia. Well, they have Asperger's. Like
Probably that special interest, that third category, that restricted pattern of behavior.
Okay.
Is often the differential.
Okay.
And I think that if we're looking at the diagnostic piece, that continuum that we talked about with autism and Asperger's, with PDD-NOS, now that's kind of been eliminated, and we have this new diagnosis that's just called autism spectrum disorder. It's that social...
2 core domains.
Yeah.
What?
It has just 2 core domains, the social communicative deficits and the restricted repetitive patterns of behavior. Okay. And now there's an added specifier. So we also specify if there is an accompanying intellectual impairment or if there's an accompanying language impairment, and we also specify the severity of the disorder. So we no longer have Asperger's, but we would reclassify it as ASD with mild symptoms.
And so I think you really get back to it's that restricted pattern of behavior that's diagnostic of the autism spectrum.
Yeah, we have another category called social communicative disorder for those who don't have those restricted repetitive patterns of behavior.
I have to say one of the things that struck me the most viscerally when I first saw this show was the use of the R word so many times.
Oh, yeah.
And so I'm going to ask Richie and Adam both to weigh in on this a little bit because you grew up with somebody on the spectrum, and Adam, because you are on the spectrum. So I would love it if you would talk a little bit about your relationship with that word and your relationship with hearing that word, times that you've heard it used against other people, used against yourself maybe, and how you reacted to that.
Me first?
The stigma that goes along with that word.
I guess how I react to the word depends on who's using it and in what context. Like if it's a classmate and they're using it to refer to like a concept or an event, it's like, oh, they don't know any better. All right, but this might be alarming to some people. I know it was alarming to my mom, but I've had teachers, both past and present, use the word, and it's like, come on, man, you should know better. Like, my mom was telling me about something that happened while I was in middle school. I used to be in band, And around the time I quit band, I believe, my mom had a meeting with the band director, and he said something to the effect of, "Back in my day, we didn't have Asperger's or autism or none of that. All we had was needing a good ass whipping." That's an actual thing that a human being said. And more recently, last semester, I was in government, U.S. government class. The teacher in that class is a big fan of the Chicago Bears, and even his teacher chair is a Chicago Bears. It has that logo on it. And he was talking sports with a classmate of mine who sat pretty close to where I was, and the classmate of mine said, "Hey, the Chicago Bears are going to lose this game," and the teacher was like, "Oh, you're R word," and I was like, "Really?" So yeah, it depends on who's using it and when, really.
So it's still obviously pretty widespread,
Yeah.
even among people who should know better.
Can I ask a quick question? Did you report these individuals at all, or do you find it creates more problems for you to report something like that?
I'm worried. I didn't get a chance to report the middle school band director, but I'm worried. I didn't want to.
I totally reported the middle school band.
Took care of that for you.
But to your question, it's a great question because it's kind of a point of contention in our house.
Yeah.
So
When
yeah,
to
talk
report
about
it.
that. Yeah.
I didn't want to really report the government teacher, at least until after I graduate, because he really does seem like the kind of guy who would take it out on me and then just kind of get a slap on the wrist, and then and then I would get punished for reporting it more than he would for actually saying the word.
Exactly.
So that's my biggest fear, why I haven't done that yet. Yeah.
What about you, Richie? Do you have experiences with that word?
No, I couldn't say it. Nothing really that relates to him. But it's just one of those words, like any other word, that just carries such a negative connotation. And everyone can relate to that, whether it be that word or a different word, whether someone's calling you gay or not, or a word worse than that, And people still like to use those words just kind of in conversation. And they're...
Very casually. Sometimes.
Yeah. I mean, not just that, but other things. And things that, if it relates to you, it kind of makes you feel like shit.
Yeah.
So,
Yeah.
just on a broad note, yes, I can.
Yeah.
No one ever uses it in a positive context.
Exactly, yeah.
That's true.
But
That's a great point.
yeah.
I mean,
Just
there it is.
perspective, and it's
Right.
a great point.
That's a great
Is
one.
it still used in a medical context? Not anymore.
Not anymore.
Okay.
And it was actually clinically in our shop a point of contention
Oh, okay.
for a period of time because it was a medical diagnosis, so it was a diagnosis the
Mentally.
medical doctor made.
Not a psychologist.
And the psychological
Okay.
diagnosis and the diagnosis the psychologists wanted to would be consistent with the measure they were using, whether it be cognitive impairment, whether it be intellectual disability, and so even in our practice, when we were meeting with families, it was a point of, now how do we talk about this? How best to establish that there's an understanding that if you use the term developmental delay, there's the belief, understanding by delay, there's going to be this catch-up.
Oh, okay.
And after a period of time, we have a pretty good understanding that that catch-up process is not going to happen. And so how do you express that to families? And historically in this country, medically, diagnostically, we've done it by tacking a label or a diagnosis on. Instead of saying, Johnny's not going to catch up developmentally. And so he's going to need supports for X, Y, and Z. And so I think for the medical carriers, for the insurance payers, those labels continue to be used, and we try to help families understand this is this is what the real life is. This is what the situation is.
Yeah.
So as of the advent of DSM-5, that word is no longer used anymore. Instead, we use the term intellectual disability.
Okay, yeah, that's what I've been hearing lately.
Yeah.
Yeah. Well, could you talk a little bit about the specific challenges for autism spectrum people when it comes to dating and sexuality? I know it's a little bit taboo, but it's very much what we saw, Jared struggling with tonight, and it seems like it'll be a very tricky time of life.
Right. So considering some of those core social deficits we talked about, perspective taking, understanding where others are coming from, empathizing, reading social cues, interpreting them and responding to them appropriately. These are core deficits and definitely plays a huge role, especially within the context of intimate relationships.
Mm-hmm.
So there's difficulty, first of all, for an individual on the spectrum to form relationships, to develop friendships, and harder still to date and have an intimate relationship. But the key ingredient to success would be a very supportive partner. A partner who understands where the individual is coming from and is able to communicate very clearly without any ambiguity what they want. So if I'm tired, just give me a hug, and I will say it to you rather than you trying to read that from me. So cues like that, told explicitly, is very helpful. Other than that, I am not aware, and I'm not sure if you are aware, of any differences in sexual preferences as far as the autism population goes and the typical population goes. Neither am I aware of any abnormal sexual development. So everything else seems to be quite typical.
Okay. I was going to ask one more quick question, and then I'm going to open it back up to you guys for some questions. Adam, what did you think about the way that Jared's family handled approaching him with this thought that they had? And do you have any ideas of how you would have rather been approached had it been you?
You said what I think they could have done better.
Yeah, like what do you think of their tactics? Do you think that they were successful, or how do you think they could have approached that maybe that would have had Jared have a better reaction?
I think the reaction, how they tried to break it to him in the play was pretty much, hey, you match the symptoms.
Yeah.
And I think
Which he didn't react to very well.
Right.
Right.
I think one way they could have done a better job is using positive role models in famous people or successful people who have who are on the autism spectrum. Like I read into it the other day. Dan Aykroyd has Asperger's. Has anyone here heard of Owl City?
Yes.
The guy that made the credit song for the movie Wreck-It Ralph. That's one guy, and he also has Asperger's. Susan Boyle has it. Some American Idol winner has it. And I was just thinking, like, they could use those people as examples of, like, hey, having Asperger's doesn't mean you're R-word, and here's proof, you know? I think they could have done that better.
And the only other comment is that the label, the diagnosis, checking the box, it means nothing. Jared needed supports for social development, and so that's where the focus of that family system should have been. So how do we frame that? How do we get supports to build those social relationships and social skills? You don't have to check the box before you work on those things.
Right.
Right.
True. Well, and I know they wanted, and I felt like, in a way, also they didn't. Well, she's not a clinical psychologist, the character. She's clearly more in research, brain and behavior, all that. But that they wanted to go to a psychologist or a therapist because they weren't sure how to do it, but he wouldn't go.
Yeah.
So it's like, how do you approach that if you feel like I don't have the tools? I mean, I guess they could go to therapists and talk about it to get some tools to approach it at home, even if he won't go. I would think, you know. But that was their big thing: is would you come to a therapist with us so that we can find some tools to work with it?
Do you have any families right now you're doing family therapy without child?
Oh yeah. Oh, yeah, a lot. I have
if
a
they're
room
younger, I
designated
think.
for family therapy.
But where the child's not necessarily even coming.
Right.
But you're giving them tools to help the
Right.
child without the child receiving some label.
Right.
I think they're treating them as an adult child, so it's more like, let's go do this as a team, but it's
We have a very
shattering to think about.
systemic approach to treatment.
Hmm.
So it's the child viewed within the context of the family.
So is
they
that
could have gone
because
there.
the patient isn't necessarily interested in participating?
Well, and the patient could be interested in participating, but we have to change how everyone responds to that individual. So the change is not exactly targeted just for the individual.
right.
It's everybody changing how they respond to that person. So it's working with everybody.
So could you give me an example of the kinds of changes that the family might need to make? I mean, I would think, especially if it's an older person, they've gotten into some pretty deep patterns of how they relate to each other. So how do you start with something like that?
It's very hard to figure all that out in the first session. So as you start to see the individual, you start to see certain patterns of behavior that are maladaptive. And for example, when adults are still living with the parents, so the first thing I want to look for is there more enmeshment than need be? And so is there any room for individualization? And why is that not happening? And so who's doing what to who? So we try to explore all of those dynamics and then, work with each family member as needed.
And we all, I think, gravitate as parents towards what's easy in many cases. If we know, I have a 14-year-old son, and if I'm going to expect him to cook his own breakfast and eat a big healthy breakfast before he's going to go to swim practice at 5 in the morning, it's not going to happen.
Right.
So it's easier to take care of it. So I think that what happens is those learned behaviors, but
You enable
are
them to
because
learn.
it's easier to not challenge that social skill that's difficult, because we know that it's going to trigger that anxiety, and we're going to need the toothbrush, and so we're not even going to go there. And so when we work with the family system, it's all right. Can we move here, this small step first?
Like, can we let them be exposed to something that's not necessarily going to be comfortable?
Safely.
Yeah. Right.
Slow steps.
Yeah.
Small steps, okay. All right, does anybody have any questions for the panel?
Will you all be coming back for other performances? I forgot. This is okay.
Well,
Thank
we want to
you.
have again tomorrow night.
I know, they're great. Did you all have any questions for each other? I told Adam I would give him a chance to ask questions too.
I just have one for Richie. Does your brother know about the character?
I don't know.
Question.
He might. I haven't told him explicitly.
Like have you told him, hey, I'm being you?
I haven't, and I don't even know if he'll
because you're not
pick up
being
on
him,
that.
exactly.
Yeah, no,
Yeah.
I mean, not. He's not.
He's
like
not Jared.
this. No, he's not Jared.
All right.
He just has some of the quirks that I kind of took from Eric. But no, I haven't explicitly told him, so I don't know if he'll say anything because he's not much of a talker. So I don't think he's gonna. I don't know. It's gonna be an experiment. I don't know if I should say something before. We'll see.
Would that be weird, Adam?
What?
If somebody modeled a character off of you?
Or if you thought they might have.
I can see where that would be weird. I wondered if that's why you asked the question.
Yeah, probably.
Would you want to know going in? There's somebody who has some quirks that remind me of your quirks.
Yeah.
Maybe I'll tell him that.
Translation. You should probably tell your brother.
Yeah.
Should probably prep him a little bit.
Yeah.
Okay, anybody have anything else? I'm going to make sure I hit all the things that I wanted to hit here.
Going once.
I think that's it. Well, I want to thank you all so much for being with us tonight. You guys were great. Thank you all for staying.